Superficial muscles of the head and neck are easily seen using anatomical models. There are two circular or sphincter muscles on the face. The orbicularis oculi orbits the eye. The orbicularis oris orbits the mouth. When sphincter muscles contract, they close the openings they surround. So the orbicularis oculi will close the eye. This is involved in winking and blinking. The orbicularis oris will cause the lips to purse. This is the muscle you use in kissing. The zygomaticus is a long muscle that runs diagonally from the zygomatic bone to the lateral corner of the mouth. When this muscle contracts, it's going to elevate the corner of the mouth. This is used in smiling. On this side of the model, you see an anomaly of the zygomaticus. It's forked or bifurcated. When this muscle contracts, it will still elevate the corner of the mouth, but it will cause the skin in this area to indent, leaving a dimple on the cheek. As we look at this lateral view, we can see this large jaw muscle. This is the masseter. It's involved in chewing or mastication, so its name tells you what it does. It chews. If you place your fingers lightly about here on your jaw and clench your jaw, you should be able to feel this muscle bulge. Most of the muscles of the face are flat, so they're attached to the skull using flat sheets of dense, regular connective tissue known as aponeuroses. These make up the fascia of the skull. If we look at the other side of the model, we'll see that several structures have been stripped away. The masseter is missing, as well as the zygomatic arch. This reveals the slightly deeper temporalis muscle. That fascia that was holding the masseter in place has also been removed. The temporalis is named for its location. It covers the temporal bone. This is another muscle that's involved in jaw closure and involved in chewing. If you place your fingers just slightly above and in front of your ear and clench your jaw, you should be able to feel the temporalis bulge. The large neck muscle is the sternocleidomastoid muscle. This is named for its origins and insertions. It originates on the sternum and the clavicle, that's the cleido part of the word, and it goes up and attaches behind the ear to the mastoid process on the temporal bone. If you take and put your middle finger on your sternum, your thumb about the middle of your clavicle, and then run your index finger up behind your ear, you will be covering the sternocleidomastoid muscle. If you try to bring your forefinger down to your thumb and ring finger, you will see that this muscle is going to make the head fall forward or flex at the neck. If you use only the muscle on one side or the other, it will abduct the head, pulling it to one side or the other. There are over 24 muscles in the head and neck region, so this is only a few of those. It's some of the more superficial muscles that are easy to see on the model, and some of the more common muscles for facial expression and head movement.